And on top of that, this new bill is going to cut back funding. It's going to cut back funding to research. Let me tell you, my son is going to research. How do I tell my son that he won't have the money to work in a lab for a cancer cure? Especially if you have a young grandchild that might benefit from that. What country out there, Switzerland, that opened the human genome? Guess what? We did this right for a teacher. Our doctors did it. Who wins all the Nobel Prizes by 90%? We do. Where do foreign doctors come to practice and research? Here in America. Now, with the future cuts that we see in the Medicare bill, like 40%, 40% cut. You know what you get for an EKG? You think we're real rich? $6. The office is $33. Go on fact.com and look it up. Now, when they cut back 40% of the cardiologists in the state that has the highest amount of seniors, Florida, will go bankrupt. What did it wake up? That's like taking all the cops out of D.C. Does it make sense to do that? They make these arbitrary cuts, and that's what happens. Then the FDA has to be reformed. It takes $1 billion per drug to get a drug approved. Do that in Eastern Europe. They do it in about 6 months with untoward complications. No, they do have complications. Here we have too much red tape. We have too many lawsuits against companies that try to make drugs and vaccines to help our people, yet they get sued. How can you ever expect a big pharmaceutical company to make vaccines if we sue them all the time? You will get 50 to 60 deaths per year on a vaccine, as opposed to 20 million deaths. Stop this malpractice abuse. I ask my Republican friends to speak to your Democratic friends that Obama has to look at this closely and say, guess what? I took $238 million, and I know I'm wrong, and I need to do something. Don't tell me you're going to have a study about malpractice that will be here 10 years from now. We need it now. So, the health care bill, let me ask you a couple of things about the health care bill. Do you really think if you take $600 million out of Medicare, think about it right now. Look at these people here. These people are still functional, wonderful people that are contributing to our society. How do I tell them I can't treat them? Now, I'm going to go over that in the bill in 1 second. In England, if you smoke, you don't get bypassed. If you're obese, you don't get a stent. Well, guess what? Obesity is part of our culture. We have to work on it. But some people just don't sit home eating all day long to get obese. They have thyroid problems, genetic predisposition. How would you feel if a doctor told you if you're dying of a heart attack here, that you can't get a stent because you're fat? Hell no. That is not the American way. Now, they're going to cut back reimbursement for $200 billion to the hospitals. That's what's going to happen. Guess what? This is going to lead to closures of hospitals around the country that provide free care to American citizens who have no insurance. Grady Hospital. Go there one day. It's better than seeing ER on TV. The only reason why they're still in business, some rich dude gave them $20 million. That's why they're still open to treat poor people. If we cut back these reimbursements, the public hospitals will close. Now, the government has negotiated with drug companies to reduce costs by $80 billion. The president has another challenge. He made a deal with the pharmaceutical companies for $80 billion behind closed doors. Wrong. He should have been harder on them to figure out a reasonable profit to allow our Medicare patients to buy drugs at 150% the cost that Canadians pay. The reason why we pay more is because of research. But don't gouge us. Don't rip us off. Make it fair. So the president has to also negotiate with the pharmaceutical companies and reduce their costs. If you look at the new things coming out right now, look at the Senate bill. They will have cooperatives. You will be able to buy insurance across state lines. You will actually have people bargaining for you. The United States government, Congressman Bartlett, should be the Walmart of health care. When they buy a bucket, they buy 1 million buckets and sell it to you for $2. Our government should go out there and buy 30 million policies at a discount. Why should you pay more? Let them reduce the price of your policies and compete. You know that little gecko out there? I just saved $200. The new system should say, I just saved $4,000 by making a phone call. And that's what the government should focus on. Why would you want them to take over healthcare? These are the people, maybe 4 or 5 years ago, I think some of you remember Genesis, I told you that this government was not prepared for a mass exodus out of Frederick. I was ridiculed by certain members here in this county saying, oh no, we're prepared. We're prepared. You know what their backup was? FEMA. And what happened 3 months later? There's a flood. FEMA failed. Do you want the same people that brought you the Postal Service to run healthcare? They want to deliver mail 4 days a week. I got a question for you. When you have your heart attack on day 5, 6, and 7, what are you going to do? That's what you don't want. So the government doesn't do well in controlling. It can regulate and it can negotiate for us. We have to make it clear when you get out of here. I've asked you to sign petitions. Tell your friends to make the government go to a system where insurance companies will compete. We need tort reform. Now, this death kind of stuff, I got 2 minutes left. Let me tell you about the death penalty. End-of-life counseling is a good thing. Every one of us, and I've been doing this for 24 years, almost coming in Frederick, it's important that when someone comes in who's terminal, that you sit down and talk to the patient and ask them if they're truly terminal, what's the best thing for them? And again, I don't want a government bureaucrat pulling up my electronic medical record saying I didn't document the end-of-life counseling. That's not the time to do it. I want to ask you a question. If you came, you saw in that jacket back there in a nice raincoat. If you came and had chest pain, you wanted an angioplasty, and the first thing I asked you is, what's your end-of-life wishes? Would you have confidence in me? I don't think so.
Hell no.
Hell no. I don't think you want that. But there is a place for it, but it's not a death penalty. So what they do is they criticize you all saying you're hysterics. You have no facts. What you say is not true in the bill. Well, let me tell you what's in the bill. That's true. And I've asked some of my healthcare providers to provide you with the bill. Let me talk about it. Cancer patients. What they've done is section 1145, page 272. Congressman Bartlett asked me to read this document. Boring. What they said is this. They look at all hospitals and then compare how much that hospital actually charges for therapy and compare it to the national average. So, do you think it's fair that Sloan Kettering or Johns Hopkins at the University of Maryland or even Georgetown University, very famous and strong in cancer, if they pay more for your wife's breast cancer because she failed conventional chemotherapy and it costs $37,000 more, and this is in the bill, are you going to punish that hospital as a high-risk hospital? No. They're your last hope. And it's interesting. As a bureaucrat, as a politician, it's easy to be brave. But trust me, when I see people coming and dying, there's no brave in that. It's scary, it's painful. You don't want to die. You want to also say, hey man, we can help you and spend the extra money, but I don't want the government in this section comparing Georgetown University and punishing it because it offers our cancer patients secondary experimental chemotherapy that will prolong their life. The other one is the most dangerous part. This is what I'd like to talk to you about. The Health Benefits Advisory Committee. House Bill 3200, page 30. I've handed it out for you. This committee shall be formed up, appointed by the President, and it shall include, for a period of 3 years, a committee composed of union leaders, businessmen, lawyers, insurance companies, one doctor or suitable healthcare provider to set up national protocols on how to treat sick. One doctor. One doctor. How would you expect me to talk to a union leader and say, hey George, what do you think of what's best for Harry? I don't know. And you have one doctor and he's picked by the White House. Now, the scientific advisor that he has right now, one of them, believes in compulsory abortions.